The Ebola virus outbreak in West African sub-region has indeed sent jitters down the spines of most Nigerians. The question is, how safe is Nigeria and indeed Nigerians when you take into cognizance the porous nature of our borders? This morning we have on Insight the Director, Port Health Services in the Federal Ministry of Health. Is in charge of land, air and sea borders. Talking of Dr. Sani Gwarzo, MNI. Sir, you're welcome on the program.
Thank you.
It's nice having you.
Thank you.
I want to ask you straight, how serious is the Ebola virus threat to Nigeria and indeed Nigerians?
Yes, thank you very much. The Ebola virus disease, or the epidemic of Ebola virus disease, is a serious threat to any nation, not just Nigeria, any nation, because the maxim goes, disease anywhere is disease everywhere. It was in the West Coast countries, Sierra Leone, Liberia. We heard about it several months ago. We were actually preparing. We have an epidemic preparedness triggered all over the country. But yet, when it really came into Nigeria, it still came as a blow. Very unexpected. We were preparing for it, but when it finally came, we realized how big it is. And for you to internalize what I'm saying, let me reconstruct for you the history of how the Ebola case, the index case, in public health, when we say index case, the first case of Ebola in Nigeria, how it came into Nigeria, time, hour by the hour. This man set out from Monrovia to come to a meeting in Nigeria. Precisely, his flight was scheduled for 8:30 a.m. in the morning. And he met a group of other people coming to Nigeria for a similar meeting. And he immediately told them he was having fever. And he thinks it is malaria and he's on medication, but he's not feeling fine. But he still boarded the plane. The plane did a stopover in Accra, Ghana, from Monrovia. Some people dropped, some people came in on board. And then it arrived in Lomé, Togo. From Lomé, Togo, the entire passengers came down. A new aircraft was brought, which is on transit from Ethiopia. It picked the entire people from that aircraft who were indeed coming from either Monrovia or Accra, plus additional passengers that came on board, and all of them came into the flight. Why am I giving you these details? I want you to internalize the gravity of the epidemic. Now, they arrived Lagos. Everybody disembarked. This man was feeling sick, could not come down. Some of the cabin crew and one of the handlers helped him by holding his arms. He was walking, but quite weak. He came down the plane into a wheelchair because it was an open bay, not the normal finger, a connected finger. And he was brought into the terminal building. A young lady who is a handler now pushed him on the wheelchair, along with her colleague, two ladies. They brought him into the immigrations, cleared him. He had a rest in between, slept on the floor somewhere, lied down on the floor somewhere, and then later on taken by taxi. Now, the fortunate thing Nigeria had is he came down sick.
Okay.
He didn't proceed to a hotel. He did not proceed to any household. He went straight to a hospital.
But he had contact with so many people,
exactly.
Immigration.
As a result, based on the mandate of the Port Health Service, we had to go back and reconstruct this history entirely, time by time. Who was with him in the plane? Who was with him on ground? What interactions went between the two of them, or the three of them, or the larger number? And we have to catalog everybody that came in contact with this man from when he entered until he was diagnosed and he died. Now, as a result, over 70 people precisely were documented as having in contact with this one. Then we did a risk ranking. Those that are of high risk, medium risk, and low risk, but nobody was of normal risk. Including those who shook hands with him, those who handled his passport, those who handled his bags, those who helped him into the car, those who helped him come down the plane, and those who helped him into the hospital.
Even the taxi driver that drove him?
Not the taxi driver, a company vehicle, an organizational vehicle that picked him, including the driver. All of them have been booked and are being followed up. Now, that tells you the gravity. It explains how serious it is. And as I'm telling you now, out of those 70, 7 of them, 2 of them have died. That is the index case has died. The Sierra Leone, the Liberian man himself.
Yeah, he died.
Yes, and a nurse.
A nurse, yeah.
Who was supporting him in the hospital. Some of the hospital workers, including doctors and nurses and other workers like cleaners, etc., who handled him at close range, and including those who supported him to come down, some of them are running temperature and they are under strict observation. And some of them have even undergone the test and tested positive. So that is how serious Ebola is.
Thank you very much. In view of what you have just said now, what safety mechanisms or screening procedures do you have to screen those who are coming into the nation on international flight?
So let me tell you what we had and how we reviewed that in the wake of the epidemic. Before the Ebola outbreak, we have several regulations on board. One, for every plane to come into a country, the pilot has to sign what we call a GENDEC, General Declaration of Health. The pilot takes stocks of everybody, signs, and before any plane comes down into Nigeria and opens its doors, the first document, in addition to manifest and other things that are given out by the pilot before the crew is allowed to release passengers out, is the GENDEC. Once we see it, the port health officer looks at it and gives a clean bill. Then other agencies can start work. Immigration, custom, etc. And the same rule applies to a ship. Any ship that is approaching Nigeria raises a yellow flag. That means in that yellow flag, it's a signal to the Port Health Service team that we are clean, but come in and verify. So the Port Health Service officer climbs into the ship, looks at the GENDEC, reviews the entire crew, reviews the environment, and gives a clean bill. Then immigration officers, custom officers enter. Now, for air travel, once this GENDEC is given, we are relaxed. But now we found that events can happen in the air, which even before the pilot is supposed to report. If anybody raises his hand, touches the white light there, say, I need attention, I have fever, I have headache, the pilot is supposed to document that and add it to the GENDEC. But that was not done in the case of this man. And remember, I told you he was sick. Again, we insist that there should be no free sitting in the aircraft. It's a very dangerous practice. Because in any aircraft, any flight, whenever people are allocated seats, is documented. Mr. A or B sat on this particular seat. If at the end of the day we find out that he or she had developed a public health disease, a disease of public health concern, we now have to locate the exact seat where the passenger sat, screen some predetermined number of rows,
people
surrounding before and after and by the sides. We have to screen every passenger. Why do we screen them? To make sure they are not exposed. Again, after screening them, we give them a form to fill, which we call traveler tracker form. Now, when they give us that form, it's detailed. My name is this, my address, my telephone number, my next of kin, their address, their telephone number, so that we can trace that person to find out how they are feeling after that encounter with a person who demonstrated or exhibited a disease of public health concern. So if airlines are in the habit of saying free sitting, now it puts everybody in the plane in danger because we cannot locate which particular seat that case sat.
And who sat next to him?
Who sat next to him or her?
Let me ask you, so at one point in the incubation period of the virus, does it become infectious?
Well, the Ebola virus is a very different virus from what we've been hearing, like HIV, which is in the blood, like other viruses that are in the blood. The Ebola virus goes into the tissue initially. It multiplies in the tissue. And it does not start getting infectious to other until it goes into the blood. And that is precisely the moment it starts becoming symptomatic. The person comes with severe fever, beyond the normal kind of fever you feel in malaria, very high fever, extreme myalgia, muscle pain, bone pains, joint pains, serious weakness, prostration. The person is extremely weak. Then you start becoming infectious. Or at the very onset of those symptoms, not until it gets worse, the person becomes infectious. So within the incubation period, we're not saying that the person is totally free, but it's more likely for the person to start transmitting the disease at the moment they start getting symptoms.
Okay.
And usually it's a very short period. Within 2 days, history has shown as low as 2 days, but also as long as 21 days. But a majority of them cluster between 8 to 10 days.
8 to 10 days.
Yes.
Now, I can see a lot of stops there.
Yes.
I can see a sterilizer.
Yeah.
What are they for? And what do you use them for at the airport? I want you to demonstrate their use.
Yes. In the wake of, well, ideally, every airport, every place of serious mass gathering, places of congregation where people meet and interact, we encourage, or we rather insist, that there should be ample flow of water.
Okay.
Sufficient supply of liquid soap. I'm very selective in my wordings. I say liquid soap. Because liquid soap is what you can use your arm to press and squirt some amount, and then you wash. But tablet soap, you now have to hold it.
Yeah.
Some people don't even rinse the soap itself, they just drop it there. And you keep applying and multiplying disease. So it's liquid soap. You press, and don't go to a liquid soap container and start pressing it with your hand. Either you can press it.
You use your elbow.
Exactly, something
You
like
press.
that. And then you now wash.
Wash your hand.
Generously. When you wash, you sanitize. And we are also advocating that there should be sanitizer. I'm not allowed to show the brand name. The sanitizer, any hand sanitizer. But be careful. There are many of them out there that are not, some of them are very fragrant. We want the one that has a high alcohol content. And the moment you squirt it and squeeze, you feel it's drying off your hand immediately. Okay. Those are the better ones.
Okay.
And the agencies that handle people frequently in the airport, they should, everywhere even, not just the airport, should have frequent hand washing. So the rules we gave in the airport community is for everybody.
So is there a prescribed way to use the standard way to use the sanitizer?
Yeah, like there is no prescribed way, but there's at least something. Let me see how you do yours.
Okay.
Yeah, you see the way you're doing it initially, I've given it to some people and they just see them doing it some kind of in fashionable way, like this, treating it. No. Yeah, you squeeze and wash everywhere. Okay. Make sure it goes into every nook and cranny. Okay. And these are not the best days to keep long fingernails.
Of course.
Probably this is the time to start doing very good neat cleans. Okay. So that you have sufficient of the disinfectants or the liquid soap to enter and clean up areas.
Okay, that's about that. Exactly. I can see something else.
Well, in the airports, we do screen passengers. Like I told you, for the general declaration of the aircraft, we still also have to screen passengers as they arrive. Ideally, we should have a mass body scanner, and as passengers are moving, you don't need to touch anybody, you don't need to interrupt the flow, because our motto...
They just pass through it.
Exactly. No, they just pass on their own, and the infrared, the thermal body reader...
But we don't have such gadgets.
We don't have them. And that's why we're resorting to this until we have those big gadgets. And it's not difficult to apply, but this is an emergency situation. We're doing with what we have. So we now have to screen passengers, and like I told you earlier, our motto is three-pronged of the public health, port health services: healthier, safer, easier movement of people and goods. Once people are moving and goods are moving, they have to be healthy, safe, and easy. Even if it is the ease that is affected, we have to review our guidelines. So for us not to interrupt people from moving, we immediately acquire these handheld devices. This is an infrared thermometer. If I point, you see there's an infrared mark that goes out immediately.
I can see that.
Exactly. This can help me guide to where I'm picking that's a laser guide, where I'm picking the temperature. And at a comfortable distance, I can pick the temperature. And if you don't mind, I can demonstrate with you.
Why not?
Now, look at this. Let me pick the temperature of the floor from here. What do you see?
26.0.
Exactly. That's about 27. We have a correction factor to make it real because of the distance.
Okay, can you do mine?
Yes, we take it on the temple.
Oh, okay.
And please remember not to look at the side I'm doing because of the infrared rays, not because of the camera. It's just, I mean the device itself. So if you can look aside. Yeah, you see the distance? I can pick your temperature immediately with this. And this shows 35.7. When we see a 37...
Is that healthy?
Very healthy. It's okay. You don't have a fever today.
Thank you.
But it doesn't mean you don't have Ebola.
I don't have it.
Yes. What I'm saying is you don't have a fever.
But I came on an international flight just 2 days ago, and nobody did this at Lagos Airport.
At Lagos Airport, we are handicapped, but we have started. And because of the many flights and the limited number of staff and equipment we have, every flight coming from the West Coast, from West Africa, is 100% screened. I guess probably you came in through an international flight from either US or Europe or somewhere. Then you may not necessarily see our staff as at yesterday, but I bet you go back later in the evening today or tomorrow, you're likely to see our staff screening every arrival. And if anybody comes through Abuja, irrespective of the country or the port of embarkation of the flight, the point of origin of the flight, we screen every flight.
Doctor, there's this talk about health workers across the nation being scared of being used, performing their duties, as it were, in the screening of Ebola. And they talk about recruiting more health workers. How true is that?
Yes. When the Honorable Minister directed us to move out, and we've already submitted our submission severally, and the Honorable Minister looked at it and said, okay, move out immediately. I told him we have these constraints. One, the limited number of staff. But immediately, we did internal redeployment, and the minister picked up the issue and presented to the Federal Executive Council, and Mr. President has approved an emergency recruitment
of health workers.
All cadres of health workers required immediately without much protocol. And the head of civil service of the Federation is working on that. And I assure you, in the next few days, we are going to be fully on ground in all the airports. And not only are we going to be screening, I want to use this opportunity to appeal to the public to be very, very cooperative with our personnel in the field, that we are going to be screening all arrivals, but we are also going to be screening people departing. Yes. In as much as we don't want to bring in the infection.
We don't want to export it.
Exactly. And that is what has put the larger strain on our personnel. But right now we are redeploying internally, and I am confident that in the next few hours we shall be fully rolling out. Thank
you. We just lost the nurse who had contact with the Liberian American. Is there a talk about having insurance policy for our health workers?
Health workers have a right to feel worried when you see your colleague dying out of his call of duty, out of compassion that he has extended to a fellow human being, and that person is coming down with the disease. You naturally feel scared. We're all human. And the ministry immediately took the bull by the horns and approved a policy of life insurance. So that is going to be rolled out, and I know the ministry is taking care of that.
Yeah, and of course, Nigerians have been talking about the efficacy of bitter cola. How true is that?
Yes, you see, the ministry also did something which is unique. It might sound foolish to some international partners who might say, why is Nigeria looking inward on this way, in this way, or why are we wasting time experimenting with things that are not authenticated? This is a life.
Why not?
Exactly.
We have the right to.
Now, we have two reasons for that. The minister has said it. Every claim that merits to be pursued will be given ample, equal opportunity to be probed, and Nigerians need the help. But two, we also had a bitter experience, you remember, during the days of HIV/AIDS.
Yeah.
I was particularly on the hot seat. I will not mention names, but I was on the hot seat at that time, and I remembered I was going to court for 3 years, along with the legal team in the ministry. It is time-consuming, time-wasting, and it didn't result in anything. Why? Because we were receiving claims ad hoc at that time. And everybody could go to the market and shout that I have a cure.
For HIV/AIDS.
Exactly. But now the minister has already organized the program. We have a committee that looks into every claim. Once you have a claim and you come forward with it, we now go into screening it, be it orthodox medicine, be it traditional medicine, be it even spiritual. Bring it.
I see whether it can be empirically proven.
Exactly.
Beyond doubt.
Once it is proven, that is what we want. All we want is...
But are you confirming the efficacy of bitter kola? I saw a lot of my friends in the studio this morning and have
you
been
find
chewing
that
bitter kola.
It's scarce in the market.
It's scarce.
But the ministry has not endorsed it. The ministry has not said anything about it, either negative or positive.
But you are not condemning it either.
The ministry, no. Well, the ministry is being scientific and professional about it.
Okay.
Screen it. Whatever the result is, let Nigerians know.
Thank you very much. Yes, that has been Dr. Sani Gwarzo, Director, Port Aid Services, in charge of land, sea, and air borders. It's nice having you, sir.
Thank you.
He's been sharing with us measures put in place to ensure that the virus does not spread beyond normal. And of course, we're able to curtail the spread of the virus within the Federal Republic of Nigeria. Thank you for coming.
Thank you.